Hi everybody. I decided to do this video kind of late at night while the house is quiet, finally. This is for my RnY update for March, the middle of the month after group. I'll do another one next in 2 weeks. I'll do another one after I see the psych doc or the dietitian for the last time. But this is kind of my update. Anyhow, I had group last Tuesday night. I go to the support group for bariatric patients at the hospital at the center where my surgery is going to be. Most everybody has had the attends group has had their surgery in excess of 5 to 10 years ago. So I'm the only new girl that is getting ready to have the surgery done. Not sure whether that's a good thing or a bad thing that I'm the only one, but I'm the only one that takes the opportunity to go, I guess. Anyhow, I had the opportunity to have a conversation with the nurse for the lady that's doing my surgery. And I asked her, I said, so the next time we have group, will I have a surgery date by then? I said, because I've already lost my 20 pounds that she wanted me, or my 10 pounds, and I ended up losing 20 that she wanted me to lose. I've attended all of my meetings. I went to the psych doctor. I've done everything that I'm supposed to do. And she said that by the time we have group next time, I will probably not have a surgery date yet. See, look, I'm getting more little hair. It's all sticking out. More little tiny hairs. She said I will probably not have a surgery date yet. She said that my last appointment is on the 25th. She said it takes 2 to 3 weeks to hear back from the insurance company. And then that she would let me know something after that. And I asked her, I said, so is it possible that I would have surgery after the 1st of May? And she said, no, I would have surgery in April. So, and doing, let me grab my cell phone so I can pull out my calendar. Doing my math. Would help if I touched it right. Okay. My last appointment to see the dietitian is the 25th. So 1 week would be the 1st, 2 weeks would be the 8th, and 3 weeks would be the 15th. After that, I could have surgery the 15th, the 17th, the 22nd, the 24th, the 29th, or the 1st. And she said it would be before the end of April. So, for some reason, my intuition says that my surgery will be around the 22nd. And it's automatically 2 nights in the hospital. I'm trying to get all this planned because I don't have anything for a support system. I have to make sure that I have I have to pay somebody to come in and take care of my daughter the 2 days that I'm laying in the hospital. So I'm trying to get that arranged ahead of time. That way I have somebody that I can count on. Because I don't want to go in and have this surgery and have to worry about whether my daughter's taken care of or not while I'm laying in the hospital and there's nothing really I can do about anything. my little hairs. I'm totally like head over heels in love with all of that. My hair is starting to grow back. I don't have chemo head no more, and it's really, really nice. My hair's up at the moment because I need to go get a perm. I hate my hair being straight. Don't mind me, I'm in my 90, okay? Anyway, so, like I said, I dropped 20 pounds. I got on the scale and I'm at 140 pounds, and I've held that. When I retain fluid, when I've had too much salt and I retain fluid, I go up to 145. Or 145. 245, I'm sorry. And my journey started at 262. So I had to drop 10 pounds, so that brings me down to 252, and I'm down at 240. So I've lost 22 pounds. Okay, so I've been kind of keeping track of my measurements because I don't really see a whole lot in the scale as far as losing my weight, but I see it more in my body, like my face. I can feel the bones. I feel the bone in my chin for like the first time in forever. You know, I'm losing it other places. So I decided back in January to keep track. So I measured myself the 1st of February, and then I measured myself just a week ago. Okay. So December 11th, January 11th, December 11th to January 11th is 1 month. January to February is 2 months. February to March is 3 months. So I'm 3 months in. Okay. And I've dropped 20 pounds in 3 months. Which isn't a whole lot, but for me, and not having this surgery and just being on a strict diet, it's actually quite a bit. But anyhow, off topic. Understand that most people, their band size and their bust size will change. Mine will not. And there's a reason for that. I had breast cancer and I lost both of my breasts. And I have implants that are up underneath my muscle. My bust size will not change. I have 575 cc's. And I will be forever a perky 40, 30, between a 38 and a 40 triple D. Permanently. It's not going to change. No matter how much weight I lose, my chest is going to stay the same. Okay. That being said, the band size could change. It could go down to, I think he said, a 36 at most. Or at the least. It won't go no lower than that. Because that's my rib cage. That's the measurement for my rib cage. And that's what he based what kind of implant to give me off of. I have 12 centimeters, 12 inches, 12 centimeters, 12 inches. From here, from the center of my chest to my armpit, where your breast tissue is supposed to stop. There's a 12-inch, something like that. I think it's 12-inch. And that's where my implant sits. Or it's got to be 6 inches round or something. I don't remember. I'll have to dig out my card and look. They kept my measurements on there because they had to measure my rib cage, not my skin, not my fat, nothing like that. They had to measure my rib cage. Anyway, band size might go down to a 36, possibly a 38. It'll never go no lower than that because that's just the way my body is. So I measured my band, my bust, my waist, my stomach, my hips, my wrists, my arms, my thighs, my calves, and my ankles. Okay? The difference between February and March, I lost an inch in my waist, 3 inches in my stomach, and an inch in my hips. And my wrist stayed the same, my arm stayed the same, my thigh stayed the same. I actually gained an inch in my calves, but I lost an inch in my ankles. So I'm seeing the changes. See, I'll show you where my implant. See, that's my implant. That'll never change. My chest will never change. It will always be this way. I'm totally cool with it. I paid $75,000 for my chest. It better not change or we're having problems. So that's non-scale victory is my measurements. I'm really, really pleased that I'm starting to see some kind of change, some kind of loss in there. I'm noticing it in my cheekbones, in my chin. I got a chin finally. I've been waiting for that forever. My daughter Chelsea, I've been having her do the same high protein diet. I've made hers high protein as well, low carbohydrate, and she's been doing really, really good with that. And she has lost 3 inches off of her stomach, and she's off of her waist. She's lost 4, and off of her hips, she's lost 2. And she looks really, really good. And I think she's starting to notice that she's starting to lose. I seen it in her face first. Just like I seen it in my face first. So she's seen it in her face first, and now she's starting to see it in her body, and she's starting to really, really like what she sees. My ex-husband come up out of nowhere. He's going to prison. He'll be at the prison here in town on Monday. So, and he's trying to kind of come back into our life. So, I don't want him back. He asked me how come I'm different now than what I was when him and I were married. And I had to tell him, I'm different now than what I was when we were married because, we were married 13 years ago. We've been divorced 13 years. And I've grown a lot in 13 years. I've grown even more since we got married. We got married 19 years ago. And I'm a totally different person now than what I was then. I've grown up more. I'm really, really sad to say that he really hasn't. Because he's in prison. He's going to prison. It's obvious he didn't grow. But it's my job to take care of our daughter and make sure she has what she needs. And he told me that he thought I was a pretty awesome mom, and he's glad that I was his wife and that I take good care of our daughter. Well, our children, because I take care of his oldest daughter too. I look out for her. She still calls me mom, and I still call her my daughter. She will always be my daughter. Let's see what else. We picked a house. Well, not really a house. It's a condo. We picked a condo in Bloomington, Minnesota, and we will probably be moving out of here the 1st of July, as long as things go right. So, I think that's all I have for you this week. I really, really like to watch you guys' progress and whatever, and I might not always comment, but know that I'm paying attention and that I watch each and every one of you. I'll try to hit the like button more often when I'm watching. Okay? Talk to you soon. Have a good week.